suppose Johnson is a father of Ali. Ali is a 9-year-old boy, and he has a cough, long time cough, and he comes to you, and after examination we find he has a examination, we do test, Montax test, sputum test, and we find he has positive tuberculosis. So now you have to expose this tuberculosis, answer father's questions, and discuss this. Understand?
Okay.
If you're ready, we can start.
Yeah.
Okay, I keep the time. Start.
Okay. Hello, good morning.
Good morning.
My name is Dr. Wayne. I'm one of the child doctor here. I believe I'm talking to Mr. Johnson.
Yes, Doctor, I'm Johnson's. Ali is my son.
Yes, nice to meet you, Mr. Johnson. I'm just here because I want to update you about a Lee test called Montauk test. Has anyone updated you about that before?
No, doctor, we are here waiting for the result.
Okay, is that time suitable if I explain to you about the results? Would you like anyone to join with us today?
No, doctor, today I'm alone in the hospital. You can continue with me.
Okay. Before I explain to you, can you tell me what you understand so far about early conditions?
Yeah, he's suffering a long time cough, like 2 months maybe or more than that. And I'm here. No one tell me anything. We do the test
I'm
only.
sorry. I'm sorry that it's being a bit late to tell you about that. That sometimes take time to interpret the results. So we finally got the results of this test, and it's unfortunately show positive for tuberculosis. Have you ever heard about this tuberculosis before?
Tuberculosis. Is it something serious, doctor?
It's a quite it can be serious. It's a bit of strong infections that's primarily seriously affect the lungs, but it can also spread other part of the body if left untreated.
Okay, okay. So what is the treatment?
That's a good question. So what we're gonna do is that this test, positive for this test, we cannot definitely say that Lee is definitely having this tuberculosis in the body or not. Sometime,
It's co-
because if
it's
there is a
confirmed. It's confirmed tuberculosis. You tell the treatment.
Okay, all right. So, since Ali has the symptoms and the positive for this test, what we're gonna do is that we're gonna also see the chest X-ray. We need to have discussion with infection specialists. We need to start on the antibiotic, which may be four types of antibiotic initially, for a few months, like 2 months, depending on the results of the sputum.
Okay, I understand. So this 4 tablet only, no, only have to take.
First of all, for the first few months, we need two tablets, and then the other remaining months we might need three or four tablets. That depend on the sensitivities of the germs. We need to also look at the sputums, the phlegms, and we need to examine his phlegm to see whether the germs is strongly resistant to the antibiotic we're gonna give to Ali or not. Does that make sense to you?
Yeah, it makes sense to me, but that's I think very big medications. 4 tablet, 3 tablets. We are telling. How can a child take this?
I can understand that. As for there's some tablet for the children, specifically designed for the children. We can have a discussions with the pharmacy, and we can
Okay.
find out the way what type of tablet might be the best suitable for Ali. Um, does that sound good for you?
Yes, yes, I understand that. Is that it gonna affect his immunity?
Actually, it won't affect the immunity. However, we need a baseline blood test first before we start in this antibiotic, and we might probably need to have a rechecks blood test quite frequently while Ali is on that medications.
Okay, understand. So, doctor, I want to tell you that he has these conditions. His school exam is near, and I want to actually now want to secret from everyone this. Okay, please keep it in secret.
Mr. Johnson, I'm so sorry that it's been a lot of difficulty. I understand. However, this infection is quite contagious. We need to inform that as our legal duty, and I can't promise you to keep it secret. And Ali might need to stay away from the schools or other places just to prevent this infection to spread to the community. I'm so sorry, Mr. Johnson.
But only 1 week. Can you please secret? Just 1 week.
N-
After that, his exam will
No,
be over.
no, I cannot. I'm so sorry. If as soon as we make the diagnosis, we found out that this infection is present, we have to, as a legal duty, as a doctor, we need to inform. And I'm really sorry, but if you ask me to help me another way, I'm happy to help you. I can inform the school and I can arrange
6 minutes.
the test not at school but at home if you wish.
Okay.
All right.
So how can I protect my family member?
That's a very good question. So, before Ali started the medications, it's better that everyone wear the mask. Do not share the towels with Ali's, and do not use the same utensil or cutlery. And but after the Ali started the medications, it's also very important that you take care of all the lay below and separated, and wear the mask all the time with Ali. Okay.
Okay. I understand, doctor. I understand.
All right. Thank you so much, Mr. Johnson, for your understanding. I understand it is quite overwhelming for lots of information to catch at one point. How about I arrange another meetings after I have discussions with the infectious specialist so that I can give you the proper management plan for Ali. How does that sound to you?
Yeah, okay.
Okay, all right. Can I just summarize just to make sure that you get my point throughout this?
Yes.
So we've discussed that Ali, the test skin test, which came back as positive. Since Ali has the symptoms along with this test positive, what we require is that we need to start medication. Before we start medication, we need chest X-ray. We need to look at the germs inside the sputum, phlegm, and we also need to do the routine blood test. The antibiotics is first we need the two types of antibiotic for a few months, and then followed by four tablets in the next few months. The durations will depend on the type of these germs, how strong the germs is based on the results of the phlegms. And we're gonna have a regular follow up while Ali has been taking these medications with blood tests. So do you have any other questions?
So, his grandpa has also this cough. So, what do we do?
He
Grandfather.
needed I'm sorry for that. He also need to test for that tuberculosis. Maybe he might be catch from grandpa, or I'm not sure. So it's better grandpa has a test, and then if grandpa tests positive, he may need to take the medications.
Okay, understand.
Okay. Thank you so much for your time. If you have any questions, you can come and have a discussion with me anytime.
Okay. So, few seconds remain. Okay. So, I'm telling you, first of all, okay, you intro given, repo, nice to meet you, tell. You clarify your role, attender, and the prior knowledge you asked, good. Then the tuberculosis come. I asked about treatment. Treatment actually you have to tell specifically that you are telling few months something. That is
Mm-hmm.
first 2 months 4 medications and following 4 months 2 medications. Okay.
Mm-hmm. Mm-hmm.
Then I asked you the question that how can he take all the pills like 3 tablet, 4? That is only one tab is available for tuberculosis. There all 3 4 tablet only one tablet it is available. Okay, affect
Okay.
the immunity. Yes, all the medication has some drawbacks, but we have to weigh the benefit against the risk. So it is very important to prevent tuberculosis from growing further in our lung to further infection in the other organ body as well. Exam you make it secret, very good, it will be secret. So how long you will be away from the school? 2 to 3 weeks from the start of medications. Also, we will discuss it with the infectious disease. Then about how can I protect the family member? You can tell like that. Uh, some step we can take, like she should use the disposable tissue in separate plastic bag. Open the door, let the fresh air to enter the house, and avoid co-sleeping in the same room. Okay. Then listen, after that what happen, you give some red flag or warning sign we give, or in some informations that is you give, like please take care that all the body fluids will be colored orange, completely harmless and reversible. We will give her some multivitamins to protect her from some drawbacks of the medicine, especially vitamin b6. Also, if you notice any deteriorations of her visions or change in color of the urine, you should seek medical advice immediately.
Mm-hmm.
So, first of all, body fluid can be orange, discolored. It is normally harmless, reversible, no problem. We give multivitamin, vitamin B6, they are telling, and also vision and the urine color. If it is changed, then seek medical advice. Something hepatitis develop, na? Side effects.
Mm.
And
Yes.
family member is will bring the grandfather here to be tested. And you have forgotten that summary website, leaflet, support group. These are
Yeah.
summary trusted website leaflet. Or otherwise, you tell everything. You summarize these and very nicely you done.
Mm.
Okay.
Thank you.
Okay.